Hi, my name is Dr. Bethany Weiler. I'm a pulmonary and critical care physician here at Logan Health and an advanced bronchoscopist. So a pulmonary nodule is any abnormality on a chest CT scan or even a chest X-ray. And pulmonary nodules are actually very, very common in the population. It's estimated that about half of all the chest CTs that are done in this country have a spot or a nodule on them. And the vast majority of them are benign. Greater than 95% prove to be nothing. The lungs, like the skin, are exposed to the environment all of the time. So if you're lucky enough to live 50, 60, 70 years, you're probably going to have a spot on the lung that's nothing more than a scar. So there are a couple of features of these lung nodules that do make them more concerning for a lung cancer. Primarily size. Anything over 8 millimeters, a little bit less than a centimeter, is concerning for a malignancy. In addition, there's some other features of the nodule itself, such as star-like projections from the nodule or locations of the nodule that can make them high risk. And if you are a smoker, really any nodule over about 6 millimeters should prompt further investigation. Here at Logan Health, we've established a multidisciplinary clinic that involves various specialists from multiple different specialties associated with thoracic cancers, such as a thoracic surgeon, interventional radiology, pulmonologists, and many others. In this clinic, a patient is seen by a pulmonologist, but their case is discussed in a multidisciplinary fashion with all of the providers so that we all can agree on the safest, most appropriate, and most accurate way to diagnose these small nodules. In addition, it's staffed by a lung cancer navigator who assists the patients in scheduling these visits, making sure things line up with just their lives, and addresses any psychosocial issues that might arise in helping diagnose these cancers. So that's a great question, and it's very nuanced. A lot of it is location, size, and also who we think can achieve the best result, again, with the safest, safety profile. So it changes with every patient. So we have always struggled in medicine to biopsy and diagnose these very, very small nodules. A lot of times it requires pretty invasive testing, whether that be surgeries or even needles from outside the chest, that can be relatively high risk, especially if the nodule ends up being nothing. Over the last 5 years, however, we've had a tremendous improvement in the technology that we have available to diagnose these very small nodules safely and accurately. So here at Logan Health, we have what's called a robotic bronchoscope. This is a system that uses and leverages advanced technologies in order to really create a 3D map of the airways that allows for really accurate navigation out to these lesions. We don't create any holes that aren't already existing in the body. We use the airway, the patient's natural airway, as a highway, so to speak, to get us to these very small lesions, even way out on the edge of the lung. With the other complementary technologies and with the addition of the robotic bronchoscope, we are biopsying extraordinarily small lesions with very, very, very low risk profile. And we're diagnosing with accuracy and saving patients from potentially bigger procedures and more invasive procedures. This is the thing about lung cancer and why lung cancer screening is so important. The lungs, unlike some other body organs, don't have any pain fibers to speak of. So lung cancers can grow in the lungs without any symptoms for an extraordinarily long period of time. Oftentimes, by the time symptoms develop, it's actually too late and you're at an advanced stage. So if you are high risk for lung cancer, if you have smoked for a significant period of your life, please talk to your primary care doctor about lung cancer screening. It saves lives every single day.